Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here today with Lauren DeMoss, a Maynard Nexon healthcare attorney. Lauren, good to be with you.
Thanks so much, Heather. It's great to be here.
And we are coming to you live from NC LifeSci. This is the annual meeting of the North Carolina Life Sciences Organization, pulling together leaders from all aspects of healthcare and life sciences to talk about what's next and how to make that happen. And we are delighted to have with us today Melissa Horn. She is the Director of State Legislative Affairs at the Arthritis Foundation. That's a nonprofit pursuing a cure for America's #1 cause of disability, while championing the fight against arthritis with life-changing resources, science, advocacy, and community connections. Thank you so much for joining us today.
Thank you so much for having me.
Now, we're going to talk about patient advocacy and policy change. We are, but first, tell us a little bit about your role, how you got into this.
Absolutely. So I am the state lobbyist, so the State Legislative Affairs Director for all 50 states at the Arthritis Foundation. I've been with Arthritis Foundation for about a year and a half, but my tenure with health advocacy is spanning almost 20 years. So I've worked for nonprofits like the American Cancer Society and the Heart Association, as well as I actually worked for the National Association of Realtors and Housing Policy for 8 years. I like to say that I'm in the business of investments, whether that's your home or your health, often related.
Yes,
because your zip code does tell a lot about the access that you have to healthcare.
Yes.
So that's kind of my professional background. I'm a University of Missouri Mizzou graduate.
Go Mizzou.
M-I-Z.
Yes. C-O-U.
That's right. So I have my background in political science and public affairs, but I'm also a 3-time cancer survivor. So I had cancer in high school, lymphoma, and I went through chemotherapy and radiation. So I knew right away that I wanted to get into healthcare policy because I faced right away before the Affordable Care Act, this barrier to getting insurance coverage. So I went and interned at the Missouri State Capitol and got into advocacy, and the rest is history. Wow.
I'm sorry you have that story, but what a great story to make you have compassion for the people that you're going to serve.
Absolutely. And I'm a big proponent of patient stories, and it really guides the policymaking process. So whether you have had cancer, or you have asthma, you have arthritis, it doesn't really, matter what you're afflicted by, but it's the experiences that you bring to the table to really push for better changes.
Yeah. Thank you for sharing that.
Yes. So you're here at the conference to talk about patient advocacy.
Absolutely.
Tell us a little more about what you're working on in the advocacy area.
For sure. So some of the issues that I was talking about today are around coverage for patients that are experiencing arthritis or any other chronic disease. So right now, medications can be really expensive. Some patients need copay assistance or, any kind of support to pay for those medications, whether they're $50 or $50,000. If they're an infusion, often they have no generics that can be really pricey. But, that barrier and cost barrier is really important to navigate. Right now, a lot of insurance plans will not count that assistance towards your deductible or out-of-pocket costs. So we are trying to restrict those kinds of programs. They're called copay accumulators. We've been successful in 22 states, DC, Puerto Rico, through legislative change. And then we've been working more recently on the regulatory side in Nevada and Minnesota to restrict those programs. So any payment, whether it comes from a manufacturer or foundation like ours, or any other nonprofit, will count towards that patient's deductible and out-of-pocket max in those states if you have a state plan. Of course, we still have to work on the federal side with Congress to pass the Help Copays Act, which is kind of mirrors the state efforts to make sure that copay assistance counts. So.
Why wouldn't it count? Whether my mom gave me the money or the Arthritis Foundation gave me the money, why?
So the argument on the other side is that it's not coming out of your own pocket. A lot of these laws are around cost sharing. So when you enter into a health plan, you have your own responsibilities. But again, like you said, whether your mom's paying it or any other third party, it shouldn't matter. Money is money. A payment is a payment. It's like if I go to Starbucks and someone in front of me is like, hey, I'm going to cover your order.
Right.
That's dedicated for me. They're not covering the entire day's worth of purchases. They're covering that specific car to pay it forward, as it were. For medications that patients are struggling to afford, it's the same thing whenever assistance is offered. But for us, we have to make sure that that assistance counts. It's like getting a scholarship for college, paying your tuition, but your tuition bill doesn't go down. So we just want to make sure if funds are dedicated for a patient, whether it's from their own pocket, literally, or from someone else's to help them pay for their care, that it's counting.
22 states. All right.
Yeah.
Next, ease of use program. What is that? Give us a background here.
Sure. So for patients with arthritis or any joint disease or swelling, chronic pain, it can be hard to navigate things like opening a pill bottle. Or I don't know if you guys struggle, I struggle. A fitted sheet.
Oh, bless.
I mean, you can't fold them at all.
No.
But sometimes it can be hard to get it on a bed.
Absolutely.
Sometimes.
All the time.
Exactly. So the Arthritis Foundation has a program called the Ease of Use program, and it's a seal that we put on products that help patients navigate things a little bit easier to use, as the name suggests. So whether it's, again, a pill bottle that has a better grip on it, if you have that swelling and problem in your fingertips, or just being able to get that fitted sheet on, or even think about the design of a building. Like if you are walking through a hallway, just making sure that there's enough space to accommodate a wheelchair. We have ADA compliance there. But even streets, think about how long it takes to cross an intersection if you have a crosswalk. How much time is dedicated for that? Patients that have arthritis might need a little bit longer. So whenever we're looking at community planning, that could be a policy arena that we pursue. But the ease of use program is really about, again, helping patients navigate, and they can just look for that seal of approval, like that patients from the Arthritis Foundation, this lead program has given its stamp of approval that this is easier to use. So that's the whole foundation for that program, and something that we try to incorporate as we're looking at policy solutions too in the community and as they navigate medical treatment.
So it's practically helpful, but it's also research,
Yes.
to present. Yeah.
Yeah, and I mean, some of the conversation here today was talking about those injector pens for shots.
Yes.
Yeah.
Now, as a cancer patient, I've had, after chemotherapy, had to give myself shots. It's super intimidating.
Yes.
Having a needle and just knowing what pressure point to inject yourself, even if it's not that big of a needle, is scary.
Still, right.
If you're not a nurse or a doctor,
Yes.
Right.
it can be really intimidating. But the new injector pens, it's a pressure point, so it clicks.
Yes.
And you know when to stop pushing.
Yes.
So you've done it right. You're getting the right medication dose, and it's just easier to use. So that's just an example of kind of the innovation that we're seeing.
Yes.
So switching gears a little bit to biomarker testing.
Ooh,
yeah.
yes.
Talk to me about what that is and how that's being used.
I love this policy area, first of all. So if you think about the process as a patient, if you have a chronic disease, when you're diagnosed, often it's looking at a biomarker. So it could be a tissue sample, a blood level, urine analysis, anything like that. Where we're headed now is to look at how your body reacts to certain medications and treatments. So we can start to look at tissues and blood samples to look if a certain medication is going to work for you. So you don't have to continue failing and being trial error constantly to figure out what's going to work for you. I say this a lot, but every body is different. So you might have the same diagnosis. You and I might have, a thyroid issue. But that doesn't mean that I'm going to absorb the medication to maintain my hormone levels the same way your body is. So if we can do more investment in the biomarker space and get that covered by insurance, we're going to be able to get to the right treatment at the right time faster.
Yeah.
And in terms of navigating utilization management protocols, step therapy where they have to fail you first on another drug before you get to your prescription.
Right.
If you have a biomarker test that shows that you're going to do well on this medication, that's more evidence to get through that faster, which saves time and money for everybody.
Will the biomarker testing help to predict the likelihood of certain side effects? Because obviously you get a medication and there's, sometimes hundreds of potential side effects listed. Some are more common, some are less common, but presumably the biomarker test in some cases could help predict whether you're going to get a severe I don't know. Yeah.
I mean, I'm not a doctor, so this would be a question probably for a physician, but I would say that it would likely help.
Yeah.
I mean, I'll tell from my own experience as a thyroid cancer patient. I have to take the brand name of the Synthroid because I have no thyroid. They removed it. So to keep my hormone levels in check, you have to have a certain level of thyroid levels. And that regulates your everything from your heartbeat to your metabolism, everything in your body. Super important. I have to have 1 pill a day, every day for the rest of my life. However, I can't take the generic because it's a tablet and my body doesn't break it down fast enough for my system to process it in the time that I need. So it makes my heart work a lot harder. So all of a sudden I was experiencing these high pulse rates, like I was running a marathon just to function for the day.
Oh, wow.
That's not going to work. So I have to take the brand name, which is a gel capsule. It absorbs faster into the body. That's the same for a lot of patients that are navigating different treatments. Like sometimes their body will cooperate and you can use the generic and the cheapest drug that might be out there. Sometimes there's no generic, and sometimes you have to navigate these very expensive treatments and you're absorbing not only all the side effects, but the cost of trial and error.
Right.
So I think biomarker testing, precision medicine is really the wave of the future here.
That's a good way to say it, precision medicine, because I think that's probably what it is, and they'll probably use AI in there to continue to learn.
Absolutely. I feel like those tests, where it can run into a problem is, those tests have to travel usually to academic centers. So it can run a cost, but it's still low cost compared to the cost of treatment and the impact on your life of all of those side effects.
Yes.
Like if I can take less things, less medications, or go to the right one first and avoid all of that, that is a game changer. It is a quality of life issue.
Yes, absolutely.
And who wouldn't want that?
Yes.
Right.
And I think every stakeholder at the table will see the cost savings there too. So we've had I think over 16 states that have passed coverage laws to ensure that biomarker testing is covered. But of course, there's still a lot of work to do. And that's just state regulated plans. If you're on an employer plan or something like that, that's an act of Congress that's going to need to change things.
Wow, okay, you do have a big plate.
Yeah.
Yeah, you sure do. Okay.
It's a lot of work. It's exciting though.
Yeah, I know. I can tell your passion is aligned perfectly. To finish us off, kind of give us your vision for the future and also maybe a little bit of the why. Why should someone care or get involved, even if they're healthy now?
Absolutely. Well, I try to pursue healthcare changes as something that you do while you're healthy. So having those conversations, developing that relationship with your healthcare providers is important, but also with your lawmakers. So I know that we're coming up on an election cycle here, so I'll just put a shout out. Yesterday was voter registration day. It's not just about the candidates that are on the ballot, it's the issues. So make sure that you're paying attention to that and get out there and participate in the process. Because again, regardless of who holds office, they're making decisions on these key issues on the state level, on the federal level, on the local level. Don't forget the rest of the ballot is what I say. Yes. But also once they're in office, whether you voted for them or not, talk with them. Make sure that you're sharing experiences because experiences are what make good policy. It's not just the facts and figures and the research that we have. A lot of great information. It's the practical. It's what's really happening out there as a patient is navigating the medical process. So, healthcare, do it while you're healthy.
Yes.
Try to get ahead of it and communicate as much as possible, but participate as a citizen. It's something that people should be proud of as an American, I think, to be able to participate in the process, not just at the polls, but in the Capitol as well.
Yes. Well, I am grateful, Melissa, for you joining us and to know more of your story because it clearly has defined your career, but I'm sure you might feel the same way. I'm like, we're going to be blessed by the work that you're doing, regardless of whether I have arthritis or not. So we wish you the best with your job. Again, Director of State Legislative Affairs, all 50 states for the Arthritis Foundation. Thank you again for joining us and participating in NC LifeSci.
Absolutely. Thank you so much for having me.